it's coming to the end of the day, and we still have one last panel that still needs to happen. So, without further ado, let me invite my colleague Robert Peck onto the stage to moderate the last panel.
Thank you so much, Jackie. I'd like to invite Riz, Filippo, Ludvicius, Priscilla, Rajan, and Peter to the stage, please. We're gonna go straight into the subject. Riz is joining us from TechnoServe, the Ignite program. Filippo Di Bari is joining us from World Food Program. He introduced himself in the previous question. Ludvicius Omolo is joining us from GAIN. Priscilla, where's Priscilla? Here's Priscilla. Great. Priscilla Bacalian is from the Buehler African Milling School in Nairobi. Rajan Shah is from Capwell Group of Companies. And Peter Wathigo is from DSM.
Right.
Thank you. Excuse me? DSM Farmish, yeah. So all day we've been listening, interesting points of view on food safety, food loss, food systems, and we haven't touched nutrition, right? And in nutrition, especially, we haven't heard about food fortification. So today, this last panel is going to be about food fortification, which is the deliberate attempt to add essential vitamins and minerals, micronutrients to the foods that we consume. Interestingly, in Kenya, in 2012, there was a mandatory fortification process where key staples like wheat flour, maize flour, edible oils, and salt were required to be fortified. So in the session today, we're going to be learning more about experiences in other countries. We're going to be hearing about experiences in Kenya. How has this worked? How has the implementation happened? How have businesses evolved and adapted to this new way of processing their foods? And the benefits of regulation in advancing large-scale fortification efforts. But before we get started, just a plug-in for IFC. If your company is interested in fortification, in getting assistance on how to go about it, doing market assessments, doing formulations, whatever has to do with fortification, please reach out to Jackie, please reach out to Natia. And IFC has a big fortification program globally, and we would be happy to engage with you on those conversations. So with that being said, let's get started with perhaps Riz. Riz, can you please elaborate a little bit about your experience on mandatory legal frameworks in countries? What are some of the advantages? What have been some of the challenges? And what do you see as we talk more about mandatory programs and effects on fortification and nutrition amongst population, please?
Thanks, Robert. Rizwan Yusuf Ali from TechnoServe. I lead the Millers for Nutrition program. So, first of all, the value of mandatory fortification. I mean, clearly, I think it's well accepted that whenever we're working with basic staple foods and trying to add some value into it with micronutrients. So the need for mandates is a tremendous incentive for companies to do that. But I'll just bring some experience into what we're seeing. We're implementing across 8 countries and 4 staple food products. And one of the biggest challenges the continent faces with introducing mandates is mandates exist on paper, but they're frequently not very well executed. If they were well executed, they'd create a lot of incentive for the industry to produce that product. Because now we have a system where if it's not well executed, those that do it are on the same basis as those that don't. So there's definitely value in it. But in terms of challenges and what Millers for Nutrition is trying to overcome there is we have learned several things. First is that many regulatory systems on food fortification have been built on a legacy of food safety. So when you talk about food fortification, it's a value addition. It's not a safety issue immediately. It's not an immediate safety threat. So if you look at biological pathogens or something, that's a safety threat. So you can't really build a system just on that. So that's lesson number one that we're trying to overcome. Secondly is because of that, regulatory agencies are always under threat or under pressure to allocate resources to it. They always prioritize safety issues first before getting into food fortification. So one of the things the program is trying to overcome is we going the other way around and first trying to understand with companies on what they actually do and build on that. So if you take a typical wheat flour miller in any country, the wheat flour milling agency already measures baking properties and how the flour is going to turn out, because if you don't do that, your flour, the baker is not going to be happy. And fortification is invisible to the consumer.
Yep.
So we're trying to build and say, use the same systems there. Same happens with aflatoxin. Companies, maize millers in Kenya are very particular about aflatoxin. And so we're trying to build on that. And then the other key area, I would say, of innovation of millets for nutrition is, yes, government regulatory systems work, but in Kenya and Nigeria, we're trying a system where we're trying to build a platform where encouraging industry to self-regulate a little bit more. And that is not only looking at fortification, it's looking at 162 data points at each company to look at the overall process, the way they engage and train their people on the product itself and all that. So, because we found that just final product testing, and many times the product is tested in the market, not even at the factory, it is not a good predictor of, sometimes you find it's fortified, sometimes it's not. Whether the company is doing it all the time is not. So that helps. And my final plug there is one of the incentives that would really help, and I saw a lot of panelists talk earlier on about many similar challenges that we face, is in some industries, we have to try and shift away from quantity-based pricing of the product to quality-based pricing. Kenya right now, if you sell poor quality aflatoxin maize flour in the market or well-cleaned aflatoxin-free maize flour, it's the same price. It completely takes away the incentive for the manufacturer to focus on quality.
Great, thank you for that. Let's turn over to Ludivicius. And can you also please, from Gain's perspective, could you elaborate also on the adoption of mandatory frameworks? How is industry complying? And perhaps what have you seen as impact in attacking or reducing malnutrition in different communities in different countries?
I'm just being informed I need to move.
Excellent.
Thank you. I think one key thing, let me just reintroduce myself. I'm Ludi Omolo, and I work with GAIN to really promote food fortification globally. So I work with a global advocacy team. And in terms of mandatory legal compliance, at GAIN we look at it in two ways. One is to promote industry compliance, and the other one is to measure impact on malnutrition. And why industry compliance? I think from experiences with voluntary fortification is that when it is voluntary, then number one, there's no incentive for industries to comply. And for those who comply versus those who are non-compliant, then it's not a level playing field. And so that brings about shortcuts, some industries trying to reduce the processes, and thus really the quality becomes an issue. Again, mandatory compliance means then we stick to certain micronutrient levels, and the regulatory bodies are also able to really surveil the industries and the market based on specific kind of standards, and of course that's for quality assurance. And for the private sector, this means that they have a justification to invest. If it is voluntary, then they don't have to invest. If it is mandatory, then the investment becomes, it's no longer a question. Now, in terms of measuring impact, mandatory fortification means that it's wide coverage. So then we can measure that impact based on a population-wide, numbers. Then, of course, issues of scalability. When it is mandatory, then we can think about how to scale fortification. And of course, food fortification, we keep promoting that it should be part of the broader nutrition strategy. And the best way to get it is when fortification is mandatory. Then it's now easier for ministries of health and related ministries to really have a conversation with that kind of legal background. Thank you.
Great, thank you. Let's turn over to Filippo from WFP. And again, knowing the richness and the presence of WFP around the globe, could you elaborate your experiences in other geographies perhaps, and in, again, going back to mandatory legal frameworks, and how has that helped on the fortification and nutrition, tackling nutrition aspects?
Okay, thank you so much, Robert, for putting in sequence this question behind the previous speakers, because I think it fits quite well. I would like to share with the audience the experience of WFP with India, where in 2024, documented by both the Indian government and WFP, 720 million people have been reached by fortified foods. Again, 720 million people. So far more than half of the population of India, which is something quite remarkable. So how did the journey started? First of all, the government generated what you were discussing before, the mandatory legislation called National Food Security Act. And that's really one of the best entry points as a lessons learned for WFP to start collaborating, because it really generates an enabling environment which cascades normally in what is important in terms of norms and regulations. So in India, the second step was to generate the Food Safety Authority of India at federal level that then cascaded at state level. So that generated standards and regulations for edible oil, milk, wheat flour, rice and salt. But most of all, there were incentives for the producers, very, very important, not negligible. So what did WFP did in terms of support to the government? 6 points. So the first one was technical support in terms of really helping the Food Security Authority of India to generate the standards and the regulations. It's not that obvious. The second one was to set up a platform, a coordination table, where all the partners, that's very important, not only the government sectors, but also the civil society, academia, the private sector, and also the other UN agencies as well, were involved and were contributing for the implementation of the legislation. The third thing which was done by WFP jointly with the government was capacity strengthening for the private sector, targeting the private sector, in terms of milling, equipment, but also in terms of access to the premix. And also all the legislative hindrances that you would get when premix of quality needs to be imported, for example, or handled, or the equipment related to the premix. Fourth point were pilots, how to convince states that only federal legislation is good. So we had, jointly with the 2 states, the Maharashtra state and a few other states, rice fortification and wheat flour fortification with iron, folic acid and vitamin B12. Anemia in India is really a major, major issue. Fifth point, advocacy. Advocacy not only for the policymakers, but also with the consumers. You can imagine what it means to fortify milk in a country like India. And also, of course, the private sectors, all the reluctances at the beginning. Last but not least, I really wanted to welcome the interventions before on data and data collection from the colleague from the academia. Accountability. So monitoring and evaluation were paramount, published jointly, produced data jointly with the government and all the partners involved. So just to summarize, two key things. Definitely the regulatory mandatory legislation is paramount. The second one is to generate partnerships and tables for discussion. And in that one, we are really looking forward to work with all the partners, including IFC.
Excellent.
Thank you.
Thank you for that. Let's turn around to Priscilla, and why don't you share with us what's the role of the milling school in Africa on education millers, and how do you go about it, and why did you introduce fortification into that process as well?
Hello everyone, so I'm Priscilla Bacalion. I'm the head of the African Milling School, which is part of Buder Group, which is a manufacturer of machine, including fortification equipment. As Buder being a leader for knowledge in the whole world with regards to milling and all kinds of food processing or grain conversion, let's say, we found that education is the key to solving a lot of the problems because you can have the best solution, the best technology, and it is available on the market, it is readily available, but even when people have it, they don't know how to use it. And some people are not convinced that the solution can actually solve the problem. So the school is here based in Nairobi, to support with education to get the message through, definitely, and then enable and empower the students coming from different businesses that are processing wheat and maize to actually fortify. We also have a laboratory, which is, and we partner with TNS, for example, on different projects, and with them for N Coalition. So last year in 2024, we did a benchmarking for all the flour in Kenya. So it was a blind sample. We were like a third party. We stored all the samples in the lab, over 200, 300 samples, and we actually benchmarked to see with these efforts that we are doing, like this awareness we're having now, and for N coalitions and the different trainings we offer, if over the next year or 2 or 3, if there would be an actual increase in the fortification in the market. So we serve as a knowledge to train, to raise awareness, and as well as really research into what's going on.
Mm-hmm. Great, thank you. Let's turn over to Rajan from Capwell. And you're on the other side of the equation, right? Because you are processing all of these staple foods. Tell us your experience since 1212, and how has business been for you, and what have you learned in this process of a mandatory scheme in Kenya?
Okay, thank you. I think I'll start the journey not in 2012, but I'll start in 2000. As Capwell Industries, we are actually a food and beverage company. We actually grain millers, but also process further value-add products. So we deal with the maize, wheat, all sorts of cereal value chains. We make porridges out of ancient grains like millet and so forth. And now, of course, we are also in other value-add. So I'll start my journey in 2000. That's when we actually, as a company, started fortifying maize flour in this country. This was when it was just, it was voluntary. And this was an idea which I kind of borrowed from South Africa, where I had visited and had seen it happen, and I said, look, maybe this is the right thing to do. But it was and then fast forward into 2012. So 12 years, it's been a very lonely journey for Capwell. A journey where, I mean, to educate the consumer has been extremely difficult. 12 years was that lonely journey where private sector, maybe 1 or 2 players were fortifying flour. A lot of different myths were going around, that fortificant was going to reduce fertility rates of women and so forth. All sorts of different things were going on. I'm not sure whether the same myth is still going on. So from a consumer point of view, I think we still have a lot of challenges of where they see the value proposition in fortification. One might think I'm still mad. Last year, we went and voluntarily introduced fortification of rice. Mm-hmm. Maybe it will take another 12 years before it becomes mandatory. But again, we say that, look, it's the 3rd most consumed staple in the country, and I think we need to start doing something about it. So we are leading from the front in the private sector and having these conversations. We are also kind of talking with regulators, bringing in standards. But I think there's a lot of opportunity to educate the consumer. On the other side, I think there's not a clear level playing field. Riz mentioned about this. If you take the maize flour, 40% of maize is consumed in the formal market in consumer packs. 60% is still consumed in the informal sectors, and they are not required to be compliant in terms of fortification. So more than 50% of the consumption of maize flour is not fortified. Now that creates an unlevel playing field. What is government going to do about that? What is private sector going to do about that? A big question around that. And then finally, on the producer side. When we look at on the producer side, again, there are challenges. If you look at premixes, it's very chaotic. There's all sorts of different qualities, whilst there are standards for premixes, but it's a very chaotic supply chain. And also expensive to do testing here. So if you are bringing fortification and mandatory, how do you also bring testing, the other side of the equation, which is to make it more easier for millers to even test for this? And just maybe one example I'll give you, and a very unique example. People in this country like white flour, yep. Extremely white flour. Now, if you put a fortificant, it's going to add some yellow things to it if it's vitamin A and so forth. Now, that's actually going to be disadvantaging a miller. So what we are actually doing is the consumer really wants extremely white flour, and so the miller is incentivized not to put the fortificant so that they can give that. So how, again, those are the kind of challenges for us as a private sector we're facing. I think I'll live with that. Thank you.
Great. Thank you so much for that experience and that journey. In turning to Peter of DSM Firmage, similar question, right? Because you're in the same space, multiple countries, multiple experiences, and how have you coped with mandatory legal frameworks, and how effective are they in your case?
First of all, let me first introduce myself, and I want to thank you and the organizers for actually letting DSM in. My name is Peter Wathigo, and I work for DSM. DSM is a nutrition partner who basically address the world's challenges in nutrition and health, sustainable living, and health sustainable living. So, yeah, and coming to your question about how we address the mandatory fortification and how we view it, mandatory fortification is core, of the process of the fortification, and it is really one of the things that provide a level playing ground for all the millers, for everyone to be able to play in the team. Mandatory fortification by itself may provide different levels of certainty to the foods that are provided, and over time, of a particular category of food, so that it contains a certain amount of micronutrients. The government legally abides food producers to fortify products with specific micronutrients. And what this means is that they are all abiding to a certain standard of micronutrients which have been recommended. This then brings a few things into the fore. One of them is policy. Then mandatory fortification brings in policy and ensures that there is a policy that guides the process of fortification. Two, the right food vehicles are actually recommended for fortification. Yeah? Kenya, for example, we have 3 main food vehicles that are actually recommended to actually carry fortificants. That is wheat flour, maize flour, edible oils and fats, and now we're actually getting into what you call rice fortification. Sugar is recommended, but it's not. It's voluntary, so it's not part of the mandatory policy. We also have a specific composition of micronutrients that actually you throw into the circle to ensure that you don't go out of the circle of the recommended micronutrients. So you have a standard, you have a policy, and that standard also defines the levels of the micronutrients. And these levels are defined by information that has been collected in the market. It's data-based. So the standards are guided by data that has been collected in the market. So we have got researchers who have actually brought in information to say the community is deficient of vitamin A and they need this level of that particular ingredient to be able to get the daily allowance, intake allowance. Yeah? So also mandatory fortification ensures that the processors abide, providing a good level of a good playing level. Because when we speak mandatory, we say, is couple fortifying? Is UNGA fortifying? Is everybody fortifying? So it ensures that everybody is fortifying. Yeah. And then, of course, we have got safety. Safety standards are in place. And then, of course, my best one is traceability. We are able to trace what is it that we are actually giving to our consumers. How do we then trace back? If the product came from a certain company, yeah, are we able to trace that back? So we are able to trace. Implementation of this, however, and I put a but, is always an issue. It calls for commitment. Yeah? Commitment from the people who are actually do the implementation, people who govern, and because it needs proper monitoring, and it also needs resources. And as Rishwan mentioned earlier, resources always bring some hindrance into it to the guys who actually implement the monitoring. Goodwill also plays part, because we have officials who will let material come in which are actually not standard. So do we have goodwill to actually do the mandatory implementation? That is a question that we also need to face. So contrary to this, we also see that sometimes all the above are abandoned and millers take shortcuts, yeah, because of poor levels of monitoring. And we want to see that there is proper level of monitoring. In the recent past, and I'm going to say this because we have done this in partnership with other organizations, including PFS and other stakeholders, we have encouraged what we call self-monitoring by millers and by processors, whereby we encourage the millers to take the mantle and be able to, how do you call it, be able to monitor themselves. What are their inputs that they put in those foods? What are the processes that they're using in those foods? What is it that they want to get out of those? And I think by and by, we have seen millers wanting to actually prescribe into that process and want really to take up. So the ground is, that's way, a level playing ground. And we see people going and taking up the fortification in the proper manner. Thank you.
Great, thank you. Going back to Reese, so we've heard pros and cons, we've seen some shortfalls that we're hearing here through the grumbles. Are mandatory frameworks the silver bullet, the solution for tackling malnutrition, or what are your thoughts on that?
No, I think definitely not. And I'll build on what Hugo said. I mean, introducing mandatory frameworks is one thing. But the key thing is to see them through. You have to implement those frameworks. And we have to look for efficiency in doing so. I think that's where the greatest weakness is. And also find the right nodes of, because we will have to get more efficient in implementing those mandatory frameworks. So what Peter, for example, alluded to is, even if you look at regulating the flour sector, well, there is quite a lot of opportunity to look at it differently and say, well, what does industry self-regulate? How do we build that goodwill with industry? How do we build that with the government? But there could be nodes. As in Kenya, when food fortification was introduced, for the longest time, the framework has been on testing the final product. But you have to go, and that even is done at the marketplace, and it's done at household level, where nothing can be done. Whereas if you look and understand the value chain better, there are fewer factories than there are households. But then, there are even fewer premix suppliers and factories, so we should be regulating the premix, the inputs, because if you put the wrong inputs in the product, you're going to get the wrong. Our study and data indicates that Nearly 100% of wheat flour in Kenya is fortified. But when you test for quality, it doesn't meet the standard. Not because something is wrong at the mill level. The mills are adding the right thing. But the inputs are incorrect. The inputs are, as Rajan also alluded, it's the wild, wild west out there. And I think we need to look at that. And we really need to look at where we're adding value to it and enabling the industry to be able to do the good thing. In many parts of the Kenyan manufacturing sector, this is not limited to the food manufacturing sector. You look at any sector out there, you almost feel like you're getting penalized for doing the right thing. And we really need to unlock those areas.
Great. Thank you for that. Ludovic, similar question for you. What are some of the shortfalls that from your perspective, you've seen in these mandatory programs that you'd like to share? Maybe we can learn something from those as well.
Sure. I think in terms of the shortfalls, and I think I'll pick a few things. Number one, in terms of regulatory enforcement, and I know my colleagues have really touched on it. I just look at it from the country's capacity, the regulator capacity. I'll give, for example, wheat flour in Kenya. Wheat flour has got 9 inputs. I think 6 vitamins and 3 micronutrients in Kenya. But Kenya is only able to test 3 of the 9. And I think it's vitamin A, iron, and magnesium, I'm not very sure about, and folic acid, that is. And what happens is, if vitamin B1 is also an input, then you can put whatever you want. One, because the government is unable to test. So it's a standard, we have it, they have no capacity. The other thing I'd speak slightly about is, a lack of data feedback loop, particularly within governments. Ministry of Health is not communicating with Ministry of Trade, is not communicating with the Bureau of Standards, is not communicating with the other players. And not just in Kenya, it's across. In some countries, you meet Ministry of Health official and you ask, so who do I speak with in Ministry of Trade? And they wonder if trade has a role. So I think across majority of the countries in Sub-Saharan Africa, Southeast Asia, this still becomes a challenge. The other thing I'd also like to speak about is gaps in fortification legislations and guidelines. Case of Kenya, we still use a micronutrient survey for 2011, 14 years down the line. Some countries have never had one. You tell them, we need to fortify because probably you've carried some, pilot studies, but at least micronutrient surveys goes for the whole population. And so the lack of this means that, number one, are we still fortifying using the right levels? Or is it not right? Or do we really need to fortify, or that solution or that problem had been erased? Again, I know we speak about large-scale food fortification. What is the threshold? And as Rajan, I think, had said, half of the production is done by those who are not mandated to fortify. That means half the population, even in mandatory cases, are not really in a position to benefit from food fortification programs. So I think some of these challenges are still there, and they more or less lead to, I don't want to mention standards, but I think within the East Africa community, countries are fortifying, again, as I think Fraser has mentioned. Fortification is 90% plus. Quality below 50. So I think it still becomes a challenge. I think I'll only speak primarily about those two. No, if I add one for the private sector, in terms of incentive, I know we still have issues of concern of cost, profit margins, for example, in cases of voluntary fortification. So obviously fortification has a cost implication. But what happens is countries still some still still treat premixes as final products rather than as inputs. I know there are, advocacy efforts going for either premix to be seen as an unfinished product or as, to be classified as drugs, so that they are really not taxed while coming in. But then in a number of countries are in the business of generating revenue. And so what happens is, if Capwell is trying to fortify rice, what that means is their rice will probably be a few shillings more expensive than competition. And what that means is a consumer like me doesn't check fortification. I buy what my pocket can afford. So what happens to them? Either they accept the loss, mostly they'll subsidize the cost so that they keep selling, and that reduces their profit margin. And so I think such kind of challenges has really led to low compliance.
Great. Now to Filippo, thinking back about large-scale fortification efforts and creating these alliances or these partnerships, any lessons, any unexpected partners that you come across the road and say, listen, we're going to think about this strategically, don't forget about X, Y, or Z player out there, and any lessons that you'd like to share on that front?
Okay, thank you, Robert. We had scratched a little bit our head about the unexpected partner. So we have been looking a little bit in our experience, and I think I have a second positive, interesting story to share. So doing a thorough partners mapping in fortification for WP, what we looked into is particularly into advocacy. And in terms of point of background, in the 76th World Health Assembly, there was a very interesting statement which was saying accelerating efforts for preventing macronutrient deficiencies and their consequences, including spina bifida and other neural tube defects, through safe and effective food fortification. So normally in this kind of arena like this one, we don't have many medical doctors. We have engineers, I'm an engineer, we have nutritionists, the policymakers, civil society, but we don't have many doctors. So we started to look into that, and we saw that one of the most interesting partners for advocacy is actually the Global Alliance for Prevention of Spina Bifida. So they are normally neurosurgeons, epidemiologists, and other health specialists which are really, really supporting concretely large-scale food fortification. And this is mainly because of the frustration they have when they face cases on daily routine. So we are starting a partnership with them on four areas. First of all, they are very, very credible, and they have the ethical authority to speak out, because they have the medical expertise and the moral stand, which really speaks to policymakers, civil society, so forth and so forth. The second point, they have, again, data. They have data. They can document concretely what is the impact or the lack of impact when fortification is not there. They can document on prevalences of neurotubal defects, which are, we all know, very prevalent where there is no mandatory fortification. The third thing is that they can humanize the narrative. They can really tell stories which strengthen the type of advocacy that they can do with the key decision makers. They can tell stories about not only about the patients, but also about the families which are hosting the patients that they face on a daily basis. Last but not least, they can also, they are medics, they are doctors, so they have a very strong lobby and advocacy platforms within the government. So, and also with the civil society and also with the academics. So basically, this is really something that we are looking in depth. Last but not least, we noticed that they were even able to keep the agenda point of fortification with the World Health Assembly, which is not negligible. Thank you.
Great, thank you. To Priscilla. So we've heard about technology, we had a session about technology earlier today. How is Buehler going about technology, helping private sector on the monitoring and compliance on food fortification in your systems?
Thank you for that. So, as I said before, the technology is there. Obviously, with more data collection, we are able to do more data modeling, even go into AI to basically predict things a bit better and control processes. So that's definitely there. But the issue is really, so like a big company like Bühler can still only intervene in this formal sector. I find we need to do better on the informal sector, so this is why we've been trying to reach out to cooperatives and things like that to get the data from them. What could be a really big game changer would be maybe to incentivize creating cooperatives for the really, really small informal millers. So that we can trace the data back and forth through this coalition and boost the improvement of the actual fortification through that and carry forth the information. So at this point, like, data is there, technology is there. With regards to fortification, maybe we can do better analyzing a bit more than 3 or 4 ingredients that are being analyzed. But I think the people who need the fortification the most are the informal sector, so we need to do better there. And as Riz and my colleagues mentioned, it has to do with a national, I would say, a national incentive to do that, specifically for the informal sector, because without that input and maybe a positive reinforcement from the government towards this informal sector, it will be very difficult to improve the way we are doing things now. So, yeah.
Good, thank you. So going back to Rajan, you were a pioneer back in the 2000s in this fortification. Now you're a pioneer in the rice fortification. What's the business case? You said in your first answer, it's the right thing to do, right? That's how you framed it. But share us about what's the business case about it.
Okay, Robert, the short answer is there's no business case. I'll put some caveats to it, right? Yes, it can become a business case, but we need some help. We need some consumer education who can actually differentiate between a fortified and a non-fortified product and are willing to say that, look, we want to go for a fortified product, even if it's not an extra cost. I mean, when we started rice fortification, as what literally you said, is that we could not increase our prices. We took that as our cost. So, because, as I said, we wanted to do the right thing. But it will require a lot of stakeholders to chip in to educate this consumer. It will require government. It will require stakeholders who are the suppliers of premixes. It will require us as the processors. It will require consumer groups. It will require all these different stakeholders to be able to educate this. It cannot be left only for the processors to do that job. The other question is, and this is a question I beg and I always ask, that fortification should have reduced the health bill of government somewhere along the line. How could we use that money cost which was saved to put more into this? But there is no data to be able to kind of come out with how we can quantify that. Because if we did, this could become a cost-neutral exercise as well. So, as I said, it can be a business case. For us, it's more of a social case. It's more of a case of doing the right thing and hoping that further down the road, and we are not hoping for mandatory. In fact, if we can educate this consumer, what's the difference between fortified and non-fortified, then we don't even need it to be mandatory. Then businesses themselves will go ahead and want to do it because that's the right thing to do. I hope that answers your question.
It does. Thank you so much. And lastly, to Peter, could you elaborate a little bit on what's the new developments on micronutrients and what is the kind of demand from institutions and from private sector on those new technologies and new developments that are coming out?
Thank you. First of all, GSM family does not, we do not refer ourselves as just suppliers of micronutrients. We take ourselves as partners who really want to be part of the project or of the process of the large-scale food fortification. Therefore, our appropriate inputs into the milling really play a big part in ensuring that there's success in the whole process of the fortification. At DSM, we work continuously to develop micronutrients which are suitable for the large-scale food fortification. Yeah? We, for example, do a lot of work to ensure that the products that we recommend for the food fortification process are suitable. And by suitable, I mean, if we take iron, for example, is it biodegradable? Are we just putting a product there just to ensure that it is part of the standard? No, we actually take those products because we research and ensure that once they are consumed, they are actually bioavailable to the consumers. Number two, we also want to ensure that the products that go into those vitamin premixes, they are stable. A good example is that our vitamin A is encapsulated, and this makes that particular product stable. And because vitamin A is affected by a lot of ecosystem, we ensure that it is stable such that by the time it gets to the consumer, there is a lot available in there, and it will do its work. A lot of all the other products, minerals and supplements, we also ensure that all of them are stable and they are bioavailable. There is a lot of demand. For example, millers, they want to have a comprehensive premix, and they also want to ensure that we analytically it's compliant. So we ensure that we also go far to train, yeah, ensure that it's cost effective. The premix is cost effective because a lot of people have got this analogy that the premix is the most cost driver of a particular product. No, it is not. We ensure that we bring the cost of our premixes to the level that will allow the processors to be able to sell their products without having to add too much of a cost. So cost consciousness is also something that we do take care of. Among other things, we are also, and Rajan mentioned this, we have new developments to ensure that, we also have other food vehicles that are actually acceptable. Rice fortification is actually something that we are throwing into the system. Because Kenya, for example, today, rice is a product that is consumed on every meal. When I was growing up, when I was small, rice, we used to only have it on Sundays when we come from church. Today, it's something that we have it on every meal, and it's actually on every household. So we ensure that we also go with the processes, with the new developments, with the innovation, because also the feeding habits are changing. So are we also changing with those food habits that the community is actually adapting? So yes, we actually do make changes, and we actually ensure that that we adapt and we produce products that fit to the system. Yeah, because we do believe that success is measured by the impact we create by doing what we do, not by what we sell.
Thank you so much. Let's open it up for a few questions from the audience. You could please identify yourself when asking the question, and who are you asking the question to?
Yes, good afternoon. My name is Moses Geshoro, and I'm from Nakuru. I'm also a Mira, so I just want to maybe put just a small input and then ask a question to the guy from Capwell. Yes, I want to talk about the case of the informal consumers and the informal millers. Yes, you said it's like 60% of the consumers are actually the informal guys. And so I want to maybe ask ourselves, why do consumers go to this informal, the so-called informal millers? The informal millers, generally to make it understood, is the portion millers that you find all over the place. And one of the reasons why people go to these portion millers is that because of the cost of their final product. The person from Capital will tell you this, that besides the fortification itself, once you fortify, you have to put it in a better package so that you can indicate that you have fortified at A, B, C, D. That increases the cost to around 15 shillings, 10 shillings for the primary packaging material, 5 shillings for the beta and the related. Thus, earns the 2 kilogram, 15 shillings goes into packaging. And the person who is the informal consumer is the guy from Kebera. This 15 shillings would mean a lot to him, including buying fat, oil, and the related. And then number two, the portion meal itself, the so-called portion meal, costs around 30,000 Kenya shillings. And then you are telling this guy to come and buy a dozer so that he can be able to fortify at a cost of maybe 50,000 shillings. Does it make sense to this business person? And you see, this is the business person, mutu wa pesa kidogo, a person of little money. And then number three, it's the business model of the informal sector. Sometimes you come with your maize, it is milled, and then you pay the cost of milling. So who will carry the cost of fortification even if it were to be done? And then very lastly, it is the issue of what I would ask is that should we continue forcing the informal guys, trying to formalize the informal, chasing them all over with the clubs, rather than making fortification voluntary so that the consumer chooses whether he wants vitamin B or he doesn't want it? Or should we continue chasing them all over the place just to formalize something that is not working? And after all, once we have stopped doing this, we are going to encourage the research institution to start doing biofortification that will remove all this trouble from mass millers. Thank you.
Okay, thank you. And that was a lot of insights, and I consider you as my colleague in the milling industry, and by no means when I actually talk about formal and informal, I think it's probably more talking about, when we talk about the informal, it's talking about the fact that how people go and take their maize rather than have it as package. And you're right, I mean, what you have said is that there's an extra cost. And in fact, that is why, in the last answer, I said, we should not make it mandatory. We should actually make it voluntary, but we educate the consumer. And let the consumer then decide whether they want to demand for that fortification. And we have ways. I mean, there are countries like in Zambia where even the posho millers are fortifying as well, right? But I fully agree that let's give the consumers a choice. Until that point in time, that we have data as government as well, that this fortification has done A, B, and C. Yep. And there is a compelling reason to say that by fortifying, we are saving as a country and making this population more healthier with data. Until that point in time, I believe we should have it as voluntary. Thank you.
Yep. Great. Any other questions? Yes, back in the room.
Thank you so much. Lawrence Alaro is my name, from Kenyatta University. I'm a researcher, biotechnologist. Now, the question that we are struggling to answer could be answered very easily by us knowing exactly what drives our need for fortification. If you answer that, in academia we call it justification for what you want to do. If we answer that, then it will be very easy for the government now to understand and know exactly that we need fortification for A, B, C, D. I think that's the best advice we could give for those who are doing fortification, because maybe somebody do not need the vitamins you'd like to add to the maize. Then, now, how much, again, are we going to add? How much Is it going to be, how much do you need now to add so that it is nutritive enough? Thank you.
Great. Anyone want to take that, please? And then you?
No, it's a very, very good question. And the first thing which comes to my mind is maybe to look at the Copenhagen Consensus. I don't know if you are familiar with that. Copenhagen Consensus is a mechanism which was set up something like probably 12, 15 years ago in Copenhagen, where top-notch scientists, researchers like you, got together from different sectors, and they made a very difficult exercise, which was to prioritize the most effective, from the cost point of view, public health interventions. Guess what? Fortification was number one. Is per person reached and per the prevention of all the NTB issues, medical issues that we were talking about before, is the number one in public health intervention in terms of cost for governments. So that's really the starting point with what you called the drive behind fortification. And cascading on the Copenhagen Consensus, there is quite a lot of research already published around that.
Thank you so much. You want to say add something else? Last word?
Sure. I think fortification is a solution to bridge the gap to better health. So number one, I think we are not fortifying. It's not curative. It's preventive. So first of all, what we are looking for is just daily intake. The required daily intake of vitamin A or of folic acid. We are not trying to cure anything. What we are saying is lack of adequate folic acid is likely to lead to spina bifida and hydrocephalus. So we are not being curative here. So when we fortify, we are not trying to cure anything. We are trying to prevent. Then in terms of the business, if I just go back to the first comment, it might be easy for businesses to say, let the consumer choose. How many of the consumers know the importance of folic acid? And two, it's not just about the freedom to choose. It's about a public health concern. So we are not trying to say that if it is mandatory, then the small-scale millers need to close down. I think that's why we are still in large-scale fortification. And we still have, nutrient and crop enrichment, the biofortification, as part of, the solutions. Of course, primarily it is still getting healthier diets. So I think these are complementary processes, and so it's not about stopping. For example, from where I sit, it's not the right use of resources to target small-scale or micro millers like posho mills, but the large scale. Let the playing field for the large scale remain. The small scale, for example, in Tanzania, and I know Sankwi, I'm not sure if they're around, they're working on something to help at the school level, because we still buy maize in the market and mill. So can the schools add the fortificants at that level? It's not so micro, but at least they get a lot of people in terms of numbers. So it's not about large-scale food fortification being forced upon small-scale millers. It's for large-scale, and of course solutions are being sought for medium and small-scale millers as well.
Great. Priscilla?
Yeah, just a quick one to add on it. I would like to repeat what I said. Education really is the key here. So apart from schools being fed the right products, and there's a lot of brands that are doing this for the schools, like Power Mandazi, that are even fortifying the finished product for the students. It's really teaching the students from when they're young the impact of nutrition on their health and on their overall life. So when they have kids in the future, they would want to like the kids to have the proper nutrition. So I think also this is a big lack in the public sector to really educate on important things since they're very young.
Great. Thank you. With that being said, I'd like to thank all of the panelists, and let's give a big hard applause to our panelists. we've been able to hear all of your opinions, and we learned today that mandatory frameworks are a start, it's not a finish. Education, data, monitoring, following through are some of the key things that we need to keep going. But we've also learned from the case in India where 750 million people have benefited, right? So there's definitely something that we should target and something that we should look forward to in Kenya as well. Thank you so much. And with that, over to Jackie.